For 33 years, the Lagoon Hospitals has been engaged in delivering consistent quality, professional healthcare and specialized services to the Nigerian community in line with global standardized Medicare. In furtherance of this drive, Lagoon Hospitals Group is unveiling 4 high-quality Medicare amenities and facilities at Ikoyi Flagship Hospital to deliver quality healthcare.
The supply of state-of-the-art equipment remains a challenge. A lot of these are extremely expensive equipment that require high maintenance, and the world is moving towards minimal access surgery such that one can leverage on technology not just to do old-fashioned operations the modern way, but also to reduce the length of stay in hospital and return people to early productivity. It is because of this that we at Lagoon Hospitals have significantly invested in the provision of such equipment. And I'll make examples of them. The first is our Kinevo operating microscope, which is used by the neurosurgeons.
The Kinevo operating microscope is designed to deliver intelligent precision positioning, reducing manual effort and increase greater certainty through its surgeon-controlled robotic system.
It's the state-of-the-art microscope that allows our neurosurgeons to now do complex operations with minimal access to the brain for procedures like brain tumors, for example, or people who have malformations in the brain that require to be dealt with. All of those things can be done now in a seamless manner using very minimal approach to providing excellent results. Same goes for the urological equipment, where we have now purchased a laser equipment to try and ensure that people with kidney stones are dealt with short hospital stay and early return to work, again using minimal access or keyhole surgery. Thirdly, we have a dialysis center now, and the dialysis center will complement our 12-bedded ICU. We've always prided ourselves in ensuring that we have one of the best critical care facilities in Lagos, if not the country. And the 12 beds that we have are fully equipped and fully staffed, because the key to providing an intensive care facility is not just the beds or the equipment, but also adequately trained staff that will ensure seamless provision of care with excellent outcomes.
The Lagoon Hospitals leaves no stone unturned in its effort to ensure that these new facilities are put to expert use and achieve optimal levels of operation. Consultant neurosurgeon Dr. Chiazo Onya explains further the importance of a high-precision microscope in an advanced 21st century medical world.
What led to the acquisition of this equipment is that neurosurgical services, are best, for one to get the best of results and optimal outcomes, that are best carried out, our surgery are best carried out with a microscope, with a operating microscope, and that's the modern standard in neurosurgical care, or we refer to as micro neurosurgery. Considering the fact that the brain and the spinal cord are made up of so many delicate portions that are not readily visible, to the naked eye. So for one to carry out surgery safely and conveniently and end up getting the best of results so that the patient is happy and you, the specialist, you are happy at the end of the day, it's best to carry out our surgeries with the microscope. In fact, majority of surgeries, 80%, if not 80 to 85% of our surgeries are best carried out with the aid of microscope. Magnification is a very important aspect that must not be compromised for one to get the best of results and the optimal outcome. And so that's the main reason why we went for the acquisition of the operating microscope. And currently the microscope that we have here at Lagoon Hospital is the newest version.
Among some of the highly advanced facilities you will find at the hospital is a new fully equipped dialysis center. chromium laser machine for detection and treatment of kidney stones, as well as a fully equipped intensive care unit facility. But who will be the recipients of this unique service?
So the people that will benefit from this program will be people that require dialysis care. So this includes people with chronic kidney disease, which might be secondary to hypertension, diabetes, or glomerulonephritis. Also people with acute kidney injury, so people that don't have long-term chronic kidney disease would also benefit from the dialysis services.
With only about 149 dialysis centers in Nigeria, with about 600 dialysis machines available for a population of 180 million people, it was only natural that the Lagoon Hospitals step in to help bridge the gap.
We decided to start up the dialysis units in Lagoon Hospital because we've seen that there is an increase in the number of people suffering from kidney disease, and there aren't a lot of centers offering the dialysis that is required. So we decided that we should put up this new service to be able to help people access dialysis.
A statistics by the National Association of Nephrologists last year revealed that 25 million Nigerians have kidney failure caused by chronic kidney disease.
I think that quite a number of the illnesses that people go abroad for are quite treatable here. Like I said earlier on, we have the preventive nephrology service. So we have the hypertension clinic. We help in preventing patients from going into long-term kidney failure. We also have the dialysis machines are available here for those that eventually have end-stage kidney disease or those that have acute kidney injury that require salvage dialysis. So those are available here, and patients don't need to go abroad to have access to those services because we have them here.
And what are some of the benefits patients can expect from the application of laparoscopic surgery to their healthcare?
The main benefits of the transurethral resection of the prostate provided by us, the consultant urologists at Lagoon Hospital, is shorter stay in hospital, lower risk of significant complications such as bleeding, and better protection to additional functions such as sexual and erectile function in men. We have also been able to provide high quality laparoscopic surgery, especially in the upper urinary tract, where we are able to, using minimally invasive techniques, remove kidney tumors and poorly functioning painful kidneys. The main benefits of this is that the patient avoids large scars, patients have significantly reduced post-operative pain, and patients spend significantly less time in hospital. In addition, there are economic benefits to both the patient and the wider society, as patients are able to return to their normal work practices after 2 to 3 weeks, as opposed to after 2 to 3 months after traditional major open surgery.
The procurement of these facilities at the Lagoon Hospital will help to stem the tide of medical tourism, which is set to gulp $1 billion annually.
A satisfied neurosurgery patient, Mrs. Diala, shares her experience.
My name is Chidima Selina Diala. I am the Business Development Manager, Morningstar International Hospital in Port Harcourt. It was a fantastic experience. It actually took my mind back to when I had my son in the United States of America. The service is very close to what I experienced over there. Lagoon is very good. Instead of going out there to spend their money, spend your time, I advise that they do that here in Lagoon Hospital, because they have all that it takes for them to do that, even more better than what we get over there. I strongly believe that their theater was something else. Then the neurosurgeon, Dr. Joe, Dr. Onya, and the one from Japan, they were wonderful. After 5 days, I was discharged from the hospital. And my people were surprised. Even my only sister in Atlanta, she was like, she couldn't believe such surgery could be done in Nigeria. You mean after 5 days, you're out of the hospital? I said, yes, I'm at home. And I said, talking, everything was like normal, though just the pains, which, that's the normal scenario. And then when I came back after 10 days for removal of the suture, People couldn't believe I'm the same person that left the hospital. So it was a wonderful one, very, very nice one.
I would want to encourage people that, rather than go abroad, the same level of care, the same level of expertise, the same team-based approach, and the external quality guarantees of the JCI should reassure people that they'll get the sort of quality that they expect worldwide. It's worth emphasizing that we have a team on the ground when patients present for arthroplasty. And those teams change as the patient undertakes a journey from assessment in the outpatient through to discharge. And teams are crucially important. When teams work well, the tasks that can be accomplished are great. And here you have teams that patients will meet in the outpatient, even before they see the consultant, where they would stay, the ambience, the comfort, the reassurance is quite important.
The Homium laser machine acquired for the urology department ensures that issues of kidney stone and kidney-related ailments are adequately and painlessly resolved.
And the equipments are specialized equipments, and they're only operated on or only used by people who are trained to use these equipments. Usually it's the surgeon and every other corollary staff who has been trained. Those are the ones who use this equipment. Every patient who presents to the hospital with a urological problem will benefit from this program, okay? Whether it's young, middle-aged, elderly, as long as the machines can take care of their problems, depending on what it is. We have evolved ourselves into a hospital that can take care of the patients the same way as they would do abroad. And the flight of a ticket, the cost, what it will cost you to pay and travel is almost equal to what you would get to have that intervention done here in the hospital in Lagoon.
With all of this investment, our strategy is to ensure that we maintain and retain as much of the medical tourism dollar that leaves the country, but more importantly, we provide care for Nigerians at home so that they are supported by their relatives, they have an early return to normal life, and they become more productive by getting to work earlier.
The continued resolve to provide world-class diagnostic and treatment options through the development of unique specialties across all medical disciplines is strengthened by the procurement of these first-class facilities and equipment. They will continue to serve as the hallmark of quality healthcare that is a signature of the Lagoon Hospitals and ensure that medical tourism will be the thing of the past in Nigeria.